Okay, let's see where we're going with the lower appendage. We're going to start with the pelvic girdle, which includes a hip bone on each side, and in between your hips is the sacrum. But I'll remind you, the sacrum is technically part of the axial skeleton. So that's the pelvic girdle. Then we're going to move into the femur, which is the large bone in your thigh. We'll get to the distal end of the femur and see the patella or kneecap. Then we get into the leg, and that is going to have the tibia on the medial side and the fibula on the lateral side. And then in the ankle, there are tarsals, 7 of those. In the foot, there's metatarsals, 5 of those. And then there's 14 phalanges. Okay, so we're going to start with the pelvic girdle. Pelvic girdle includes 2 hip bones, all right, a right and left hip bone, also known as coxal bones. So coxal bones are the hip bones. In between is the sacrum. So this entire structure is called the pelvic girdle. You'll notice that in this hip bone, we shaded in 3 different regions. These 3 regions used to be separate bones. All right, so when you're born, there's separation to all 3 of these. All right, and it takes time for them to all fuse into one hip bone. But now they're regions. So this green would be the ilium. This blue area is the pubis. And this orange area is the ischium. All right, so ilium, pubis, ischium. There's joints that attach the 2 hips to the sacrum. Those are known as sacroiliac joints because it's between the sacrum and the ilium. All right, sometimes it's just referred to as SI joints. There's the iliac crest. So that's this portion here and here, and that's probably what you kind of associate as your hips. If you were asked to put your hands on your hips, that what you feel there is the iliac crests. There is a joint in the front that holds the 2 pubis areas together. That's called the pubic symphysis. And we'll talk more about what a symphysis is, but that uses a piece of fibrocartilage to hold those 2 bones together anteriorly. All right, so that's the pubic symphysis, and the 2 sacroiliac joints hold these bones together to form the pelvic girdle. What else is there? Well, there's got to be a socket, right? So you got another ball and socket joint between the femur and the hip. And the socket portion is known as the acetabulum. So acetabulum means cup-shaped. So it's kind of shaped like a cup, right? Because that forms the socket for the head of your femur. So when we get to the femur, we're going to see that this head right here, a lot like the humerus head, sits inside of a socket. In this case, it's the acetabulum, whereas when we were looking at the humerus, it attached to the glenoid cavity or fossa. So that's the acetabulum. Then there's a couple holes here, all right, known as the obturator foramen. And obturator means, the meaning has something to do with the fact that there's a membrane that kind of covers that hole. But that hole there is for nerves and blood vessels to be able to go kind of from the pelvic cavity down into the legs. This is a lateral view. Sometimes this view confuses students, but you kind of have to think about what we're looking at. So we're looking at the lateral side. So here's the socket, right? There's that acetabulum. All right. Notice the acetabulum is actually formed by all 3 bones. So all 3 bones, the ilium, pubis, and ischium, all come together at that acetabulum and form that socket. There's the iliac crest up here. There's a notch right here called the greater sciatic notch. Now, some of you might have heard of the word sciatic before. There's a giant nerve called the sciatic nerve, and that notch is so it can kind of pass down from your gluteal region eventually down the back of your leg. All right, so there's a little notch there to give that big nerve some room. There's a little spine back here. That's called the ischial spine because it's a little spine on the ischium. There's that obturator foramen. That's a very large hole in your hip. And then this area here, which is basically what you are sitting on. So if you're sitting down right now, you're actually sitting on your ischial tuberosities. And there's a layer of fat in between the tuberosity and your skin. So you're kind of sitting on a little layer of fat. But it's kind of rough surface. That's what a tuberosity is. But that's basically what you're sitting on. All right, so that's the hip or coxal bone. So remember, a hip bone, that's kind of a layman's term, but in anatomy, we call that a coxal bone. A little bit of comparison here between male and female. The pelvic girdle is probably the most obvious thing to look at when you're comparing male and female, and that's due to childbirth, right? Females have to have a slightly different pelvic girdle to allow birth of a child. So basically general structural differences. Male bones tend to be heavier and thicker. The pelvic brim is narrow and heart-shaped in a male, wider and more oval in a female. All right, so the pelvic brim there allows birth of the child. And then you can see that there's some other differences here, but the one other difference that is quite noticeable is this angle here. So this angle is known as the subpubic angle. And in a male, this angle tends to be less than 90 degrees, whereas in a female, notice it's greater than 90 degrees. And that again helps widen the birth canal. And this joint will become very flexible. All right, so towards the end of pregnancy, this joint is super flexible and can open up that birth canal even more. So that's a little bit of comparison between the two pelvic girdles. So let's get into the femur. So the femur is, pretty notorious as being the largest, strongest bone in the human body. It forms a ball and socket joint at the proximal end, and it forms a hinge joint at the distal end. So your knee is a hinge joint. So we have the head of the femur, and that head of the femur articulates with the acetabulum of the hip. There's a neck, and you'll notice this is quite a bit different than the humerus. The humerus has a neck, but it's barely, noticeable, whereas this femur has a pretty long neck. All right, and the problem with that neck is inside that neck there's a lot of spongy bone, and that spongy bone is what gets affected by osteoporosis. So as an individual develops osteoporosis, it really weakens this neck of the femur, and it can fracture. All right, so that's a common location for a fractured femur. Moving distal, there are trochanters. All right, now so this is another one of these new words. There's a greater and lesser trochanter. They're kind of analogous to the tubercles on the humerus. If you recall, those tubercles are for muscle attachment. Well, the femur also needs muscles attached to it. And just so happens these muscles are quite large, so the trochanters are quite large on the femur. So this is the greater trochanter, and then this is the lesser trochanter. Then we move distal, and there are condyles. The condyles are pretty large at the distal end of the femur, and those articulate with the condyles of the tibia. So condyles go to condyles. And we'll take a much closer look at this when we get to joints. We spend quite a bit of effort learning the knee joint because it's one of those joints that gets injured quite a bit. So the condyles of the femur, medial and lateral, attached to the condyles of the tibia. medial, and lateral. And that forms the knee joint. And then here's the patella, or kneecap. And I'll remind you, the patella is the largest sesamoid bone in the body. And that patella has a base on top, so that's this side here. It has an apex, or a point, kind of pointing downward. And then there's an articular facet on the posterior side, which allows it to attach to the femur. And then if we go distal from there, we see the tibia here, your larger shin bone, and then the fibula over here, which is lateral. So just taking a closer look at that kneecap or patella, the base is on top, the apex is on the bottom, and then the articular facets here attached to the femur. All right, so the patella doesn't make contact with the tibia or the fibula. It kind of slides up and down on that distal femur. All right, tibia and fibula. First thing we want to know, who's medial? So the tibia is medial. The fibula is lateral. You'll notice quite a dramatic size difference. The tibia is weight-bearing because it gets all that weight from the femur. So the femur doesn't make contact with the fibula. So none of that weight goes directly from the femur into the fibula. So the fibula is more for stability. Kind of definitely at the ankle area, it provides a lot of stability. But the weight-bearing bone is the tibia. All right. So let's look at the fibula. So it's lateral, so it's on the outside. All right. Non-weight-bearing. The proximal end is known as the head, and then the distal end is known as the lateral malleolus. So malleolus means hammer, kind of a small hammer or a mallet, if you will. Not quite sure why, but someone thought it would be a good idea to name that kind of after a hammer. So there's a lateral hammer and a medial hammer. And the medial malleolus is the tibia. So the tibia has condyles, all right, that attach to the femoral condyles. There's an area, right here that's not identified on this slide, but it is very important to know. It's known as the tibial tuberosity. So the tibial tuberosity is a little surface right here for your quadriceps muscles. All right, so your quadriceps muscles are these large muscles in your thigh, and their tendon attaches to this tibial tuberosity. All right, the tendon is either known as the quadriceps femoris tendon, or sometimes it's referred to as the patellar ligament, because in that tendon is where the patella is encased. Right? That patella is a sesamoid bone that is encased in that patellar ligament or quadriceps femoris tendon. So that's the tibia and the fibula. Now we're going to move into the tarsals, metatarsals, and phalanges. So metatarsals, again, those are going to be in the foot. Okay? But we want to look first at these tarsal bones. So what do we need to know there? Well, there's 7. Okay, so instead of having 8 like the carpals, there are 7. There is a mnemonic if you want to use it. Tall centers never take shots from corners. That's kind of a basketball reference if you don't know. But, it doesn't quite, make as much sense as maybe the one we used in the wrist. But how I teach these is not with the mnemonic. I like to go 2, 2, 3. All right, so the proximal 2 tarsals are the calcaneus. So calcaneus is your heel bone. All right, so you've probably heard of your heel, and that heel bone is your calcaneus. Then we have the talus, and the talus is very important because that's where your tibia and fibula attach. Okay, so notice that there's these smooth surfaces here All right, so your tibia is going to attach right here, and then your fibula is going to attach over here. So the talus allows your tibia and fibula to attach. If we move distal to the calcaneus is a cube-shaped bone called the cuboid. If we move distal from the talus, there's a bone called the navicular. And navicular has a similar meaning as scaphoid. It means kind of boat-shaped. So someone thought that resembled a little boat. All right, so the first two, calcaneus and talus. The next two, cuboid and navicular. And then we have the three cuneiforms. And cuneiform, that word means wedge-shaped. So these bones are shaped like a wedge and are found distal to the navicular. So those are your 7 tarsals. Metatarsals are named very similarly to the metacarpals. We use Roman numerals. So this would be metatarsal 5. Oops, that's wrong. Another typo. So I got these reversed. So what we'll want to do is fix this. So this is metatarsal 1, 2, 3, 4, and 5. So the big one, right, which is kind of your big toe side, that's metatarsal 1. And then the one on the outside, right, your pinky toe side, is metatarsal 5. All right, I'm going to fix that. And then we have phalanges. We got proximal, middle, and distal, and your big toe only having a proximal and distal. All right, much like your fingers. All right, so that ends chapter 7. Again, you're not going to learn all these in one sitting, so just kind of break them down into groups and get into a routine, get into repetition. Best of luck. Let me know if there's anything I can do for you.